Hello, everyone. Good morning, good afternoon, good evening. My name is Alvin Yeo. Greetings from Singapore. Thank you for attending today's webinar. Before I begin, I'd like to say a big shout out to the ITI HQ, the Scientific Committee, for organizing and making this World Symposium online event possible. Now, my topic today focuses on the challenges of the Asian rich profile. I call it the crazy rich. Now, when we are dealing with patients requiring implant therapy in the anterior maxilla, we typically face with three risks. Risk number one, when a patient sees you for a tooth that requires an extraction, now obviously there's going to be a problem from the beginning. This is often due to some form of chronic dental infections or trauma. So already at the start of the treatment, we are dealing with a problem, most likely a facial bone loss. Risk number two, physiologic ridge alterations following extraction often result in an unpredictable ridge resorption pattern. This often results in buccal flattening of the bone walls, and many a times these healed sites would present as a significant flattening and a certain degree of buccal and crestal bone loss. Risk number three, it is an established fact that the facial bone walls of teeth in the anterior maxilla are often very thin. These tend to be measured less than 1 millimeter as facial bone wall thickness.